We're going to begin tonight, though, with new information on a $1 billion proposal for Western New York veterans health care. The current VA Medical Center in Buffalo is on Bailey Avenue up near UB South. We've reported on the plan to replace it with a brand new massive hospital about 6 miles away, right on the Buffalo-Niagara Medical Campus. This week, we got our first look at a federal report that details a lot of what is in the plan. And joining us right now to talk about it, we're pleased to say, is Danielle Bergman. She is the Assistant Director of the VA Western New York Healthcare System. We really appreciate you coming on the town hall. This is such an important topic, and we know so many veterans and their loved ones have a lot of questions. They see the headline, this is a $1 billion project, and they want to know more. And I want to start by kind of showing our viewers the timeline on, again, this proposed $1 billion hospital. So it would first have to be approved by Congress and also the president. That's not an easy process. We're told that could take about 2 years. Once approved, though, it's expected to take 10 or 15 years to design and build it from start to finish. So that means veterans are going to continue to use the current building on Bailey for at least a decade, maybe longer. So in the meantime, about $200 million in projects have already been approved for that site, many of them in the design, planning, and construction phases. Our partners at Buffalo Business First detailed some of that work, and you can see it on your screen. $20 million for a new research lab, $20 million for 2 more floors on the parking ramp, $51 million for renovations for various inpatient and outpatient rooms and procedure rooms, and then $109 million in infrastructure improvements for things like the kitchen, HVAC system, electrical, electronic health records, upgrading that as well. So, Danielle, that is a lot of work that's being planned for the building right now that's eventually going to be emptied out. Walk us through why that's necessary, and I'll reference what your director, Michael Schwartz, described to Business First. He said it's kind of like building your dream home, and that takes a while, and in the meantime, you have to live, right?
Absolutely, it is. And that's probably the best analogy that we can give to our veterans and our local community, is we are committed to providing absolute top-notch health care to our local veterans, and we need the space and the facilities to do that. That includes here at our current hospital, and with all of those planned upgrades that we have, those are all necessary for us to really keep the doors open, the lights on, and the best care provided to our veterans.
Looking ahead to the new hospital that, again, the plan right now is to build it right in downtown Buffalo at the medical campus. One thing that stood out to a lot of people, it's going to have air conditioning, as most modern buildings would now. That doesn't exist in the current facility. But what kinds of other modern improvements can veterans expect at this brand new hospital? And I wonder if you can address one of the concerns that we've heard from the community about consolidating services, right, and putting them all together. The worry is that sometimes means eliminating services or making them harder to access. Can you assure us that that's not the goal here, that that's not what's going to happen?
Yeah, the Air Commission report from VA Western New York Healthcare System really showed a light on what we actually do here. And they acknowledge the fact that the work that we do for our veterans, a whole encompassed care, is really top notch. There are no plans to reduce our scope of care. So that should be something that veterans can rest easy about. And I think consolidating those services into one building will help us provide one-stop shop for our veterans. And that's something that we, for the most part, are able to provide here in the Bailey Avenue facility. A veteran may come in and see their primary care doctor, but that primary care doctor might be concerned about something. Well, that concern might roll into needing to have x-rays done, needing to have blood work, maybe needing to go see a specialist. They can all do that right here in our building. And so our goal is to continue that. We do have other sites of care spread around the local market, including some of our mental health services, our homeless program, and other sites. And we want to consolidate those into one facility. And you are right, we are excited about the air conditioning. It will allow us to do a lot of different things. But the one thing that I think that we're most excited about is just the modern facilities. Our building was built in the 1940s, and it doesn't provide for things that we need. For example, a modern OR. The ceiling heights for many of the new equipment that we want to install and are looking to install just don't allow. And our engineers and our project teams are as creative as possible, but sometimes it's a little bit of a Tetris game trying to get all the pieces to fit in our building.
Yeah, I want to ask you a little bit more about the current building, because people naturally wonder what is going to happen to it once this new one replaces it, right? What's that going to mean for the university district? It was built in 1949, as you mentioned. Everybody agrees it's outdated, structurally deficient, and it's also massive, more than 1 million square feet. The Buffalo News pointed out that that's more square footage than New York City's iconic Chrysler building. So I think that kind of gives people some perspective on this. Is there any way that the current building is going to be able to be repurposed in some way, or should we all just kind of expect that it's going to have to be demolished?
So I think the current building right now has really, really good bones. It's structurally sound, and we've been keeping up with renovations throughout the year. We've renovated inpatient units, and we're in the process of beginning a renovation of another inpatient unit. We've also renovated admin spaces and other clinical outpatient spaces. So it's a good building. I don't think that it would be torn down. I think it's something that could be repurposed into housing or other things for our community.
Finally, as you're preparing to kind of start the process to build this brand new hospital, and we mentioned it's a big undertaking, I imagine you take a careful look at our local veteran population and kind of the needs that we have here. These are some stats that kind of stood out to us. The current facility on Bailey averaged 109 patients per day for inpatient stays in 2019. It's the most recent data we could find. And then the VA report put out says that the number of local veterans enrolled in the system is projected to shrink by almost 16% by the end of this decade. Also, demand for inpatient and surgical services expected to go down about 14% by the end of the decade. Quickly, if you can, how does that kind of factor into the plan that you're doing moving forward, and how you kind of design this new hospital to fit what we have here locally?
I think that's a huge factor in what we designed for the new hospital. I think other things that we need to think about are we have several of our populations are aging, so they're going to have specific needs for geriatric population. We're also welcoming home many more female veterans, and so we want to invest in new female veteran care spaces. So that's important to us. So there's a lot of different things that get considered in the design process to make sure that we have a facility that can, again, last another 75 years for the VA.
Danielle, I'm out of time, so I just want to ask you one final question. Any idea on when we might know for sure, like, this is approved, this is definitely happening? How quickly can that happen?
Yeah. We're expecting that in the next couple years. So
okay.
About 2 years is when we should know whether or not we have funding for a new facility.
All right, we'll be following it closely as our veteran population will be doing as well. Danielle Bergman is Assistant Director of the VA Healthcare System here in Western New York. We appreciate you coming on and helping us better understand this.
Thank you for having me, Michael.